this video, I'm going to show you how to safely take antibiotics while breastfeeding. We'll discuss the risks and benefits of taking antibiotics while nursing and provide tips for taking medications safely when breastfeeding. 1. What risks are associated with taking antibiotics while breastfeeding? When taking antibiotics while breastfeeding, there are several potential risks. These include a decreased level of effectiveness, as the antibiotic may not pass through to the baby in adequate amounts, as well as an increased risk of side effects for both mother and baby. Antibiotics can also be passed through breast milk to the infant, which could cause adverse reactions, such as skin rashes or stomach issues. Additionally, if an antibiotic is overused by a nursing mother, it can lead to bacteria that live in her gut developing resistance against certain drugs, potentially leading to more difficult treatment options for future infections. It's important to weigh these risks when deciding whether or not to take antibiotics while breastfeeding. 2. Should I stop breastfeeding while taking antibiotics? No, you don't need to stop breastfeeding while taking antibiotics. Most of the time it is safe for both you and your baby. However, if you notice that your baby begins to develop signs of irritation, such as a rash or stomach issues after taking an antibiotic, then it's best to contact your doctor and discuss possible alternatives. While many antibiotics are considered safe for both mother and baby while breastfeeding, some types may be contraindicated, so make sure to check with your healthcare provider before taking any medication while nursing. If an antibiotic is not safe for use during breastfeeding, there are several options available, including pumping and dumping milk after each dose, or switching over to formula feeding temporarily until the course of medication has been completed. It's important to always follow the advice of your physician when it comes to taking any type of medication while breastfeeding. 3. Are there any antibiotics that are not safe to take while breastfeeding? Yes, there are some antibiotics that can pass through breast milk and could potentially be harmful to a nursing infant. Some examples of these include tetracyclines, chloramphenicol, streptomycin, and gentamicin. It is important to discuss the risks and benefits with your doctor before taking any of these antibiotics while breastfeeding. In addition, it is also important to tell your doctor if you are pregnant or planning on becoming pregnant, since some antibiotics may harm an unborn baby. If a mother must take one of these medications while breastfeeding, it is recommended that she pump and discard her breast milk for 24 to 48 hours after finishing the course of medication. This can help minimize any potential risk to her nursing infant. 4. What tips can I follow to ensure the antibiotics are taken safely while breastfeeding? Take your antibiotics as prescribed by your doctor or pharmacist. Do not skip doses, change the dosage, or stop taking them without consulting the prescriber. Ensure you are taking the antibiotic for the full course of treatment, even if your symptoms improve before finishing the medication. Stopping too early can lead to relapse and antibiotic resistance. Breastfeed just before taking a dose of antibiotics so that it is at its lowest concentration in your milk when baby nurses. This will reduce his exposure to it and any potential side effects. After each dose of antibiotics, wait 2 hours before breastfeeding again to give time for your body to metabolize most of the drug from your bloodstream and milk supply. If your baby experiences any adverse reactions, such as diarrhea, vomiting, or rash from the antibiotic, contact your doctor immediately. Discuss with your primary healthcare provider about other options, such as probiotics or herbal remedies you can use to reduce any potential side effects for your baby. Make sure to stay hydrated and eat a balanced diet while taking antibiotics, as this will help keep your milk healthy and plentiful. 5. Is it okay to take antibiotics while pumping and storing breast milk? Yes, it is generally safe to take antibiotics while pumping and storing breast milk. However, it is important to be aware that many antibiotics can reduce the amount of milk you produce in the short term. To maintain your supply of breast milk, you should pump or nurse as frequently as possible after taking antibiotics. Additionally, if any medicine or supplement may affect your baby's health, including antibiotics, it is important to talk to your doctor beforehand and consider not storing that milk for future use. Always practice caution when taking medications while breastfeeding. It's essential that you consult with your doctor before taking any prescription medication or supplements while nursing. It's also important to speak with a healthcare professional about any over-the-counter medications you are considering taking to ensure that they are safe for both you and your baby. If a medication is not considered safe, there may be an alternative option or other changes that can be made to help keep you and your baby safe. You should also avoid taking any herbal supplements without discussing them with your doctor first, as some herbs can affect the quality of breast milk. Taking antibiotics while breastfeeding may increase the risk of antibiotic resistance in your baby, so it's important to discuss this with your healthcare provider before deciding on a course of treatment. 6. What should I do if I experience any side effects from taking antibiotics while breastfeeding? If you experience any side effects while taking antibiotics while breastfeeding, it is important to talk to your doctor or pharmacist. Some potential side effects include nausea, vomiting, diarrhea, and yeast infections. Your healthcare provider can help determine if the symptoms are related to the medication or something else. If needed, they may be able to suggest a different antibiotic that has fewer side effects. Additionally, they may be able to recommend other treatments to prevent or minimize any side effects you might experience. It is also important not to stop taking an antibiotic without first consulting with your healthcare provider, as this could lead to more serious health complications. 7. Is it safe for my baby to consume breast milk that I have taken antibiotics in? Yes, it is generally safe to consume breast milk that has been taken with antibiotics. Breast milk is an excellent source of nutrition for babies, and the beneficial bacteria in breast milk can help protect your baby from developing infections. However, you should always consult with your doctor about any medications you are taking while breastfeeding, including antibiotics. Your doctor will be able to provide more detailed advice on how best to proceed with any medication. Additionally, it is important to give your baby probiotics when taking antibiotics so as not to destroy all of the healthy bacteria in their bodies. Probiotics are live microorganisms that are believed to have health benefits when consumed in adequate amounts. We hope this video helped you understand more about the risks and benefits of taking antibiotics while breastfeeding. Remember, it's important to always speak with your doctor before making any decisions regarding medications while nursing. If you have any questions or would like additional information on how to safely take antibiotics while breastfeeding, please leave a comment below. Don't forget to hit that subscribe button so you can stay up to date with all our latest videos discussing topics related to parenting and health. Thank you for watching.